Let's talk about how the AMA in general has treated perimenopause and menopause over the past 20 years. Let's start with the symptoms. Perimenopause, menopause, night sweats, hot flashes, vaginal dryness, discomfort with intercourse, loss of sex drive, foggy thinking, weight gain, sagging skin, achy joints, mood changes, goes on. Traditionally, what have most women heard from their medical providers? These symptoms, your experience there, are inevitable, or it's part of the aging process, suck it up. Or this is the most common, sounds like you're depressed. I'm going to prescribe an antidepressant. Why do these patients get these answers? Well, it comes from the Women's Health and Age Studies that was published in JAMA 2002 that concluded that replacement therapy likely contributes to heart attack, stroke, invasive breast cancer, pulmonary embolus, deep vein thrombosis, dementia, and bone fractures. So what happens? The FDA puts a black box warning, and nobody uses it. Medical school quits teaching it. Residency programs quit teaching it. That was in 2002. Nobody's been taught. So 20 years later, here comes Dr. King reporting in the Mayo Clinic proceedings in February of 2019, less than 7% of OBGYN, internal medicine family practice, felt adequately prepared to manage women experiencing menopause. Okay, so now what happens? November 11th, the FDA comes out, says they reviewed all the literature, and by golly, hormone replacement is not bad. They took off the box, the black boxes. So what happens is this. They not only did that, they're promoting safe and effective use of hormone therapy. So here's the dilemma. You have the FDA saying that, hormone replacement should be considered, but then less than 7% of the physicians feel adequately prepared to manage them because they haven't been taught. So here's my two suggestions. First, find a medical provider that's got ample experience, keyword experience, in using hormonal therapy. Don't end up being their guinea pig. Well, let's learn how to do this. Also, number two, make sure your medical provider has been adequately trained and board certified in comprehensive, keyword comprehensive medical care. That's usually 4 years of medical school, 3 to 4 years of residency. So you ask this question, why 7 to 8 years of comprehensive medical education necessary? Because comprehensive medical knowledge allows you to interconnect the hormone replacement with the rest of the body. Think of a Rubik's Cube. If you change the estrogen, progesterone, or even the testosterone, you got to think about all these other systems. You move one box, everything else is going to change. You got to understand how that all works. That doesn't come easy. It takes a long time. For example, night sweats, a real basic symptoms, correctly, usually, contributed to menopause. But wait, night sweats can be caused from a lot of other things. So you turn that box around. Maybe it's endocarditis. Maybe those night sweats are from a hidden infection, Lyme's disease. We recently found a lymphoma that was causing night sweats. Endocrine problems, medication interactions, autoimmune disorders, sleep disorders. Recently had a sleep apnea causing the night sweats. So without comprehensive understanding in those broad areas, these health problems will be totally missed because of total lack of knowledge on the provider who doesn't have comprehensive understanding. So you're going to see lots of self-proclaimed, particularly now, experts, specialists popping up saying that, oh yeah, we can do this. Do your homework. Be smart. Choose wisely. If you're interested, check out our website, madsenmed.com. Have a great day.